Hello, everyone. My name is Jimmy Martinez, and for my social issue presentation, I chose to focus on burn pit exposure and the long-term health impacts on U.S. military veterans. I chose this topic because it connects directly to the public health, environmental justice, and systematic health inequalities. Burn pit exposure affected many service members during the post 9/11 military operations in places like Iraq and Afghanistan. As someone who's deployed to regions where burn pits were commonly used near patrol bases, I also understand how routine and unavoidable these exposures were in everyday operations. This topic stood out to me because it highlights how environmental conditions, institutional decisions, and delayed policy responses can shape long term health outcomes for vulnerable populations. Burn pits were large open air waste disposal sites used extensively during military deployments. They burned a wide range of materials, including plastics, chemicals, medical waste, and other hazardous substances without proper environmental procedures or protections. Many veterans who served in Iraq and Afghanistan or Kuwait and surrounding areas were exposed to toxic smoke on a regular basis. Research and government reports have connected these airborne hazards to long term respiratory conditions such as asthma, chronic bronchitis, and other lung diseases. One important issue is that many veterans struggle for many years to receive recognition or health support related to these exposures. This transformed the issue from simply an environmental concern into a larger social justice and public health issue. We're going to watch a quick video.
Now at 5:30 on this Veterans Day, the White House is announcing new steps to look at the health effects of exposure to toxic contaminants while serving in the U.S. military. There are growing concerns as veterans of the Iraq and Afghanistan wars develop a range of cancers after being exposed to military burn pits.
Marine veteran Kate Hendricks Thomas has stage 4 breast cancer. She learned of her diagnosis 4 years ago when she was 37 years old. She recalls sharing the news with her young son.
We've started to tell him the truth that, mommy has a terminal condition and it is going to kill her, but that she'll always be with you.
Hendricks Thomas was diagnosed more than a decade after returning home from Iraq. She learned something was wrong during an annual exam. Hendricks Thomas nurse practitioner told her to get a mammogram based on where she was stationed. She says the radiologist told her it looked like she had been dipped in something.
When you burn hazardous materials, that you have hundreds of toxic chemicals that can be inhaled into a person's body.
California Congressman and Dr. Raul Ruiz has been working on bipartisan legislation to make it easier for veterans to access benefits by including a range of cancers among the illnesses that are considered to have a presumed link to burn pits. Currently, veterans have to prove a direct connection. Hendricks Thomas says it took her 3 years for her claim to get approved after an initial denial.
Hendricks Thomas says she is now focused on helping to change the system for others and cherish her time with family.
As you can see, these are not just numbers or statistics, these are actual people. And they're not necessarily in combat roles. They could be in support roles. It doesn't matter. Burn pits are unbiased. The issue can be analyzed through the framework of social determinants of health, which refers to how environmental and social conditions influence health outcomes. In this case, environmental exposure became a major detriment of health because service members were placed in conditions where toxic inhalation was unavoidable. The use of burn pits was not random. It was an institutional decision tied to military waste management practices and operational priorities above human priorities. Another important factor involves power dynamics. Veterans often had to prove that their illnesses were connected to deployment exposure, while institutions were slow to fully acknowledge responsibility. This reflects structural inequality because the burden of proof was placed on individuals rather than the system that created the exposure. This also connects to the concept of slow violence, which describes harm that develops gradually over time and is often ignored until it becomes widespread. Burn pit exposure is also an environmental justice issue because a specific population was disproportionately exposed to hazardous environmental conditions without adequate protection. Veterans and advocacy groups played a major role in the bringing of national attention to this issue. Their efforts contributed to programs like the Burn Pit Registry and eventually helped lead to the PACT Act, which expanded healthcare access and benefits for veterans affected by toxic exposures. Overall, this issue demonstrates how public health outcomes are deeply connected to policy decisions, environmental conditions, and institutional accountability. It also reinforces the importance of health equity and the need to address systematic barriers that delay care and recognition for effective communities. Thank you. And this is just another one. Locate your local veteran and tell them to register for the burn pits for PACT Act. And these are references. Thank you again.